Hello, everyone. Welcome to our Zoom meeting. Today, we will have three items or three topics. Dr. Raghad is going to moderate the meeting, and she is going to present the first topic about nutrition. When you are ready, Dr. Raghad, please go ahead.
That's okay. Assalamu alaikum. Good afternoon or good evening, everyone, wherever you are. Welcome today. Today we will be talking about a lot of things, actually. We have a lot on our agenda, inshallah, 4 tasks. My name is Raghad Asim. I'll be moderating today and presenting your first topic. If it's okay that I share my screen now.
Yes, go ahead.
Just a second. It's not allowing me to. Is it okay that I leave and join again? Maybe it'll let me then?
Yes, yes.
Just a second, doctor. I apologize.
So here are some of the topics that we will discuss and the resources. So Dr. Raghad is going to join us again, and she will present. Dr. Mohamed, are you ready? Do you have your presentation? Maybe we can start with you and then we can move on to Dr. Raghad when she joins.
Yes, I'm ready. Let me see if I share my screen.
Okay. Thank you.
Okay, now this should be fine. So our agenda for today is number 1, a nutrition presentation done by me, inshallah. Number 2, how to use AI to get new research questions or ideas by Dr. Alaa Khalifa. Number 3, apps that are used by interns, PGY1, by Dr. Mohamed Makkawi. And number 4, a Hantavirus presentation, inshallah, by Dr. Nabiha Naqvi. Okay, inshallah, I'd like to start with my nutrition presentation. It's just a simple practical overview on geriatrics nutrition. So the important topics to be covered, inshallah: age-related changes, nutrition screening and assessment, nutritional syndromes, nutritional interventions, and culturally appropriate nutritional care. So we'll start off with why nutrition matters. It supports healthy aging and prevents frailty and falls, improves quality of life, and reduces hospitalizations. So we'll start off first with age-related changes. So the first thing we're going to look at is malnutrition in older adults is a spectrum, and it spans from undernutrition all the way to overnutrition, and both can be associated with many chronic diseases. Age-related changes in physiology and metabolism can alter nutritional requirements of older adults. So physiological changes include less muscle and bone mass, a lower metabolic rate, a decreased total body water due to reduced sensation of thirst. And this shift actually is why the volume of distribution is altered for many medications. And we'll get into that later, inshallah. And also, let's not forget changes in taste and smell. When we look at the energy requirements in older adults, basal metabolic rate is very important. Now, what is it? It's the principal determinant of total energy expenditure. It reflects the loss of lean body mass, particularly muscle mass, that occurs with aging. Now, on to macronutrient needs. The Food and Nutrition Board of the Institute of Medicine of the National Academics recommends a balanced daily diet consisting of adequate carbohydrates, proteins, fats, vitamins, minerals, and fluid. The first thing we're going to look at is protein, which is necessary for maintaining muscle strength. The normal recommended amount is 0.8 grams per kilogram per day, or 1.5 grams per kilogram per day under stress. With regards to protein intake, restriction may be necessary in certain conditions such as renal or hepatic diseases. For fats, 20% to 35% of total energy intake per day with reduced cholesterol, saturated fats, and trans fatty acids is necessary. For fibers, 30 grams per day for men is enough, 21 grams per day for women is also enough. Balanced carbohydrates, 45% to 65% is necessary. Now, there's a website called MyPlate or choosemyplate.gov, which is it's a website that provides nutritional guidance for various demographics, including older adults. It's a modified version of a traditional food pyramid that we have, and it's gradually starting to replace the older pyramid models. It's developed by the US Department of Agriculture, the USDA, and it offers easy to understand recommendations for maintaining a balanced diet and energy intake. And this is very important because it emphasizes avoiding oversized food portions and choosing lower fat dairy products, making half the plate fruits and vegetables, and ensures that at least all of the grains consumed are whole grains. Now, when it comes to fluid intake for older adults, older adults may not feel thirsty. Dehydration now can now cause confusion. This is why we need to encourage regular fluids daily. The fluid needs for older adults is met with 30 milliliter per kg per day. Fluid needs may increase or decrease depending on certain scenarios. So for example, episodes of fever and infection, as well as with diuretic or laxative therapy, is when we may need to increase fluid intake. Dehydration is the single and most common fluid or electrolyte disturbance in older adults. Now, a couple of common signs to look out for dehydration are constipation, decreased urine output, mucosal dryness, and confusion. Now, regarding nutritional screening and assessment, this is a very important slide because there are several ways to evaluate nutritional status, and so it includes anthropometric measures, for example, like body weight in kilograms or height in meters, and that can help us now formulate body mass index using the metric system. It's a formula that takes the weight in kilograms divided by height in meters squared. Other anthropometric measures like mid-upper arm circumference, others like assessment of usual dietary intake and laboratory testings are very important for nutritional screening. In addition, there's a tool called Mini Nutritional Assessment, or MNA, that can be used to help identify older adults who are malnourished or at risk of malnutrition. Now, what is MNA? It's a validated screening tool that's used to assess the nutritional status of older adults, and it tells me if they are well nourished or if they are at risk of malnutrition or yeah. And it does that by taking into account a series of questions like dietary intake, their recent weight loss, their mobility, psychological stress, or any current acute illnesses, neuropsychosocial problems, and their body mass index or cough circumference. Now, why is anthropometric measures useful? Unintended weight loss of 10 pounds in the preceding 6 months is a very useful indicator of morbidity and hospitalization. According to the minimum data set, the third version, it considers weight loss of 5% in 1 month or 10% in 6 months as very significant, especially in older populations. Now, nutritional intake. Inadequate nutritional intake has been defined as average intake of food groups, nutrients, or energy 25% to 50% below a threshold level of the recommended daily intake. Poor intake is often an indication of illness. And laboratory tests. So in the geriatric nutrition, prognostic values are laboratory markers that help predict a patient's nutritional status, disease severity, recovery, and overall health outcomes. And two important markers that we look at are serum albumin and cholesterol. Now, albumin is a protein made by the liver and is commonly used as an indicator for nutritional health status. The normal in the body is anything between 3.5 to 5.5 grams per deciliter, and its importance is low levels of albumin can indicate malnutrition, protein energy malnutrition, inflammation, infection, liver diseases, and even kidney diseases. In older adults, hypoalbuminemia is associated with increased morbidity and mortality, delayed wound healing, frailty, and longer hospital stays. Prealbumin may better reflect short-term changes in protein status because of its shorter half-life and has largely the same limitations as albumin. The second one is cholesterol. Cholesterol is another prognostic marker used in older adults. Very low levels of cholesterol in older adults may suggest malnutrition, chronic illnesses, and poor overall health status, and is even linked with increased mortality risks, functional decline, and frailty. Now, on the other end of the spectrum, high cholesterol, elevated LDL, increases cardiovascular risks, etc. Now, we don't usually prefer to look at albumin as a perfect nutritional marker. Why? Because its level also decreases during stress, inflammation, illness, and even if the nutrition is adequate. Drug-nutrient interactions. So we've already mentioned medications can modify the nutrient needs and metabolism of older adults. Many medications can induce anorexia, reduce intake of by causing dysphagia, inattention, or xerostomia. Medications that precipitate constipation also reduce appetite. Now I have a table. The overall gist of this table is that many medications induce anorexia, and most important classes being cholinesterase inhibitors, SSRIs, calcium channel blockers, H2 blockers, proton pump inhibitors, narcotics, NSAIDs, analgesics, diuretics such as furosemide, and potassium-sparing diuretics, are all just inducers of anorexia. Okay, now this slide shows the common risk factors that can affect nutritional status in geriatric population, being depression or isolation, because they may lose appetite or motivation to prepare meals, alcohol or substance abuse. This is a self-explanatory one because it just overall reduces nutrient absorption and overall quality diet. Limited education. Some elderly individuals may have less knowledge about balanced nutrition and healthy food choices, especially when they're all alone, not surrounded by people or their families. Poor dentition. Dental problems such as missing teeth or ill-fitting dentures can make chewing very difficult, causing them to reduce their food intake. Limited mobility, because difficulty in walking or cooking can prevent older adults from then shopping in the first place or even wanting to prepare their own nutritious meals. Financial and social barriers. Limited income may reduce access to healthy food, medications, or any nutritional supplements or extra nutrition supplements that are needed. Chronic illnesses, diseases such as diabetes, stroke, dementia, or heart diseases can increase nutritional needs or reduce appetite. Social isolation, elderly people who live alone may skip meals, have less interest in eating regularly. So in conclusion, these factors increase the risk of malnutrition in geriatrics. So early nutritional assessment and support is very important. This slide, we're going to discuss the nutritional syndromes. There's two very important ones that we're going to cover today. Firstly, as we already mentioned, involuntary weight loss. It's considered significant when an older adult loses more than 5% of their body weight within 1 month. It can usually indicate underlying medical condition and therefore requires early evaluation. Common causes, it has many etiologies, but its most common causes are organ failure, which accounts for 50% of the etiology, such as COPD, congestive heart failure, chronic renal failure, infections, etc. Neoplasm, which accounts for 20% of involuntary weight loss, so your cancers. Idiopathic also accounts for 20%. And then you have psychosocial factors like depression or any social isolation accounts for 10% of weight loss. The second condition is obesity. It's defined as BMI equal to or greater than 30 kilograms per meter squared. It is associated with hypertension, diabetes, cardiovascular diseases, obstructive sleep apneas, osteoarthritis, so just a lot of comorbidities. Management usually includes a balanced diet, a well-balanced diet, behavior modification, and regular physical activity. In geriatrics, the goal is not only weight reduction, but also maintaining strength, mobility, and overall function. In frail, obese older adults, it's very important that we emphasize strength and function and preservation on strength and flexibility rather than just weight reduction, even when they're obese. Now, what are the interventions we can do to prevent undernutrition? Preventing undernutrition is a very easy method. You can do it by enhancing food intake. There's a lot of ways to do it. So you can cater their food preferences as much as possible. You place 2 or more adults together at the same time in the same place to increase their sociability and food intake. You can prepare food with appropriate consistency. Make sure that you're paying special attention to the color, the texture, the temperature. Use herbs and spices to compensate, as we mentioned earlier, their loss of taste. And you avoid hard to open packages. Just an overall nutritional supplements to increase their nutrient quality. Yeah, just multiple forms. And it can be in liquid form, there's tap forms, there's bar forms. So it's just chosen based on the patient's preference, basically. Now, according to the USPSTF, current recommendations for older adults include daily intake of calcium, which is 1,000 milligram, and vitamin D, 800 to 1,000 international units per day to prevent osteoporosis. It's very important for bone and fall prevention because, as we know, osteoporosis and fractures in general are very common in older patients. Therefore, supplementation can help. Now, when it comes to cultural and ethical care, ethnic and religious customs are 2 of the most important factors that influence food preferences. And they're very connected. They're connected inseparably and can affect their eating patterns. A quick example would be an 82-year-old Muslim woman in a long-term care facility obviously will prefer halal food. And she'll be very accustomed to eating rice, yogurt, legumes, So when now put on a standard diet or a standard therapeutic diet without consideration for her background and given pork-based or non-halal meat, she'll start eating less, she'll start refusing her meals, increased risk of weight loss, sarcopenia, micronutrient deficiencies, and just overall reduced trust in care providers, and therefore leading to a very poor quality of life. So this is just a very quick example to put into perspective how important culture and religious appropriation for geriatric nutrition is. It directly affects energy intake, protein consumption, and just their overall outcomes. So respect cultural food practices, discuss feeding decisions compassionately, and honor the patient's wishes at all times. An ethically competent older adult has the right to accept or refuse medical interventions. And has the right to refuse any medical interventions. An example would be artificial nutrition, hydration, any feeding tubes. So the right remains valid even if the decision involves declining life-sustaining treatment. The patient has decision. This is just provided that the patient has decision-making capacity and gives informed consent or refusal. So just to summarize and give a quick recap on our lecture, nutrition significantly affects healthy aging population. And quality of life in older adults. Older adults are at a high risk of malnutrition because of psychological changes, chronic diseases, medications, and social factors. Early nutrition screening using weight changes, BMI, dietary intake, and assessment tools is essential to detect problems promptly. Proper interventions such as adequate protein, hydration, social support during meals, and individualized dietary plans can improve outcomes. Nutritional care should always consider cultural preferences, ethical principles, and patient-centered decision-making. Any questions? Thank you very much. We've come to the end of my presentation. I hope you have liked it, and if anyone has any questions, you're more than free to ask me. I'm here, and I'm willing to answer any of your questions. Thank you, Dr. Alaa. Now, it doesn't seem to me that there are any questions. If it's okay with Dr. Alaa, now we will be moving on to the next presentation, which is how to use AI to get new research questions and ideas, like Gemini.ai. So Dr. Alaa, if you're ready.
Yes, I'm ready. Thank you so much, Dr. Raghad. It was amazing presentation. Now I will gonna share my screen.
Thank you very much. On to you now.
So, hello everyone. This is Dr. Alaa Khalifa. Today we are going to talk about something that is changing the way researchers, students, and academics start their work, and that is using artificial intelligence to generate and refine a research question idea. So whether you are working on thesis, a journal paper, or a research project, the first and most critical step is always, what is my research question? And that is exactly where many people get stuck. So today I'm going to show you a practical step-by-step approach to use AI as your thinking partner, not to do the work for you, but to help you think better and faster. So our agenda today, we will start by understanding why AI is relevant to this challenge. Then we will explore the 5 key ways AI actually helps. Then we will go through 2 powerful research frameworks, Finer and Becot, that you can use together with AI. I will then give you the exact prompt formula to get the best results, followed by real copy-paste ready examples. We will look at the best AI tools available right now for your research question, and we will close with the do's and don'ts and ethical guidelines you need to be aware of. By the end of today, you will leave with a practical toolkit you can use immediately. So why AI for research question? Let's start with the honest reality. Coming up with research question is genuinely hard. Many researchers stare at a blank page for days. You have a broad interest, maybe something like mental health and university student, but you don't know how to make it a specific, original, or researchable. On the left, you can see the 4 biggest challenges people face. Starting from scratch, feel overwhelming. Topics are too broad. You are not sure what gaps already exist in the literature, and you don't know if your question is original or already answered. On the right side, this is where AI completely changes the game. With AI, you can brainstorm 10 times faster. You can ask it to scan the literature for unexplored angles. It helps you turn a vague topic into a sharp, focused question, and it can give you instant feedback on whether your question is realistic to pursue. The key word is partner. AI doesn't replace your thinking, it accelerates it. So 5 key ways AI helps you. How does AI help? There are 5 ways I want to highlight. Number 1, brainstorming at a scale. You can ask an AI to give you 20 different angles on your topic in seconds. That would take you hours on your own. Number 2, gap analysis. AI can help you identify what has not been studied yet. It can point you toward the white spaces in the literature where a new study would be most valuable. Number 3, refine and narrow. Once you have a broad area, AI can help you drill down from I want to study climate change to how does extreme heat affect exam performance. And secondary school student in urban areas, something specific and answerable. Number 4, methodology match. AI can suggest the most appropriate study design for your question, whether it is a survey, an experiment, a systematic review, or a qualitative interview study. And number 4, feasibility check. AI can evaluate your question against criteria like ethics, novel, and scope before you invest months of work. We will talk about that frameworks in the next slide. So, final framework. Before you commit to research a question, you need to run it through a quality filter. One of the most respected framework in research methodology is called FINER framework. F stand for feasible. Can this actually be done? Do you have access to the participants, the data, the time, and the budget? I stand for interesting. Is this question genuinely interesting to you, to your academic community, and potentially to funding bodies? Research take a long time. You need to care about it and stand for novel. Does your question add something new? It doesn't have to be completely original. You can replicate a study in a new context, a new population, or with a new methodology, but it must contribute to something. E stand for ethical. Can it be carried out without harming participants? Does it respect privacy and informed consent? R stand for relevant. Does it matter to your field or to your society? Will the answer to this question make a difference? What I want you to do is use AI to evaluate your question against each of these 5 criteria. Just paste your question into ChatGPT or Cloud and say, evaluate this using the final criteria. You will get detailed, actionable feedback in seconds. Now, the second framework is BICOT. If you are working in health, medicine, nursing, or any clinical field, there is a second framework that is essential, and that is BICOT. BICOT stands for B population, I intervention, C comparison, O outcome, and T the time. The idea is simple but powerful. Instead of asking a vague question like, does diet affect diabetes? BICOT force you to be precise. In adult age 40 to 60 with type 2 diabetes, that is your B. Does a low carbohydrate diet for 12 weeks, that is I. And T compared to standard dietary advice, that is C. Reduced hemoglobin A1C level and body weight, that is your O. You now have a research question that is crystal clear, testable, and search ready for a literature review. AI tools like ChatGPT can take your broad clinical interest and automatically construct a BICOT question for you. Research actually shows that AI generated BICOT question score compared to those written by trained nurses and clinicians, which tells you how powerful this combination is. So, prompt engineering blueprint. Now we get to the heart of the session. How do you actually talk to AI to get great results? The answer is prompt engineering. The formula you see at the top of this slide is your golden rule. Rule plus context plus task plus constraints plus format. Let me walk you through each one. First, role. Tell the AI who to be. Start with act as an expert researcher in public health. This frames the AI to respond with the right vocabulary and depth. See context. Give background. I am a master's student studying the effect of social media on adolescent mental health. The more specific you are, the more relevant the output. T. Be explicit about what you want. Generate 5 focused, researchable questions on the topic. Constraint. Set the rules. Each question must be final, compliant, suitable for quantitative research, and feasible within a 1-year timeline. Format. Tell AI how to present the answer. Present results in a table with 4 columns. The question, its significance, the study design, and potential challenges. When you use all 5 parts together, you go from getting a generic vague response to getting a structured expert level output that you can actually use. So now we have live prompt examples. Let me make this concrete with 3 prompts you can copy and use today. Prompt 1 is brainstorm mode. You set the AI up as a methodologist. You tell it your level and field, and you ask for 80 questions with a rational study design and challenges for each. This is your starting point when you have an area but no specific question yet. Prompt 2 is gap finder mode. This is for when you have read some literature but you are not sure what is missing. You ask the AI to identify three under researched gaps and propose a question for each. This is especially powerful combined with tools like Elect and Semantic Scholars, which we'll see in the next slide. Prompt 3 is final evaluator mode. Once you have a question you paste it in and ask the AI to rate it 1 to 5, and each final creation and suggest two improvements. This is your quality control step before you invest a serious time. I would encourage you to take these three prompts, customize the practice with your own topic and test them today. So now this is the best AI tools. Not all AI tools are equal for this task. Let me give you a quick map of the best option. Let's start with ChatGPT. ChatGPT is the best all-rounder. It is excellent for brainstorming, refining question, and thinking through methodology. Start here if you are new to this. Cloud, which is the AI developed by Anthropic, is particularly good for deep analysis and for handling long documents. If you are based in an entire literature review and ask it to find gaps, it handles that very well. Perplexity AI is your best option when you want answers that are grounded in real life sources with citation. It works like a research grade search engine. Now, Elicit is specifically built for academic work. It can extract BICO element from paper and it's fantastic for literature reviews. So number 7, search for academic paper and give you an AI summary of what the evidence actually says. It's great for checking whether your question is already answered. And Semantic Scholar give you citation graphs and topics and topic maps, perfect for understanding the landscape of a research area visually. So my recommendation is, if you are new, start with ChatGPT or Cloud for ideation, then move to Perplexity or Elicit to ground your question in a real literature. So now let's move to do's and don't and ethics. Before I give you the master prompt, I want to spend a minute on reasonable use because this matter. On the do side, use AI freely for brainstorming and expanding your thinking. Always verify any claim AI makes, especially any statistic or citation it mentions. Because AI does make references, apply finer or bicot to evaluate whether it generates. Customize your prompt to your specific field and level. And always disclose your use of AI according to your intuition or journal policy. Or journal policy. On the don't side, never submit AI generated text as your own writing. That is academic dishonesty. Never trust AI citation blindly. Hallucinations are real and common. Don't skip your own critical judgment. AI give you material to work with, not a final answer. Avoid over relying on a single tool and never bypass your institution's ethical review requirement. Even AI help you design the question. The bottom line is AI is a powerful tool, but you are the researcher. You are the expertise, and your judgment matter, and your integrity are what make the research valuable. So, so finally, so the key takes here. So let me bring this together with a five with a five thing I want you to walk away with today. One, AI is your thinking partner, not a replacement for your expertise. Use it to think better, not to think less. 2. Always apply structured frameworks like Finer, Code alongside. AI structure is what turns a good idea into good research question. 3. Master the 5-part prompt formula: role, context, task, constraint, format. That one formula will transform your quality of everything you get from AI. 4. Always verify, validate, and critically evaluate AI output. It is a starting point, not a final answer. 5. Stay ethical, disclose, follow guidelines, and protect the integrity of your work. If you do these 5 things, you will be ahead of the vast majority of researchers using AI today. Now, finally, here is really finally. So, here is it, the master prompt. This is your single ready-to-use template that combines everything we covered today. You tell the AI to act as an expert in your field. You describe your level and your topic. You give a brief summary of what is already known. Then you ask for 5 well-structured questions that address a gap, are finer compliant and match your research method. And for each question, you ask for the question itself, why it mattered, the suggested methodology, and the key challenges. All you need is all you need to do is replace the bracket with your own information, and you will have a set of research question in under 2 minutes that would have taken you a days to develop on your own. The research question is the foundation of everything. Get it right, and the rest of your research becomes significantly easier. So, thank you very much for listening for my presentation, and I'm happy to take any question.
Thank you both, Dr. Roth and Dr. Ala. These are both wonderful presentations. Any questions or any addition or any story about how you use the AI, for example? If you want to share, maybe Dr. Ala yourself, we start with you.
I have something to say. Is that okay?
Please go ahead.
First and foremost, thank you very much, Dr. Ala. I think this was a very insightful presentation on how to formulate a new research question using AI. Not a story or anything, but I have already, I'm very quick on everything, and I took screenshots on your prompts and your templates that you gave us on the ready-made prompts on how to formulate. And also I took another screenshot on the exact tools that are necessary for each department of your research question. So like you said, ChatGPT was a good tool for overall, whereas Claude was more specifically for deep analysis. I think that was very important. I took a screenshot because I'm in the exact position right now of trying to formulate a research question, and inshallah this will help me. So yeah, thank you very much on an insightful presentation.
Most welcome, Raghad. And if you want, I will gonna share the presentation in the group. And for Dr. Nader question, I actually used different AI tools like ChatGPT, Cloud, and Gemini. I don't only rely on one AI tools.
Great. Thank you both for sharing. Anyone else wants to share or?
Hello, Dr. Nader.
Hello.
Yes, I want to share my experience.
Your voice a little bit far. Can you come to the mic closer?
Yes. Can you hear me well now?
Yes, go ahead, Dr. Marwa. Thank you.
Okay, I want to share my experience. I used ChatGPT and Claude when I need assistance, and I found Claude really amazing. Actually, I think it is better than ChatGPT by far. particularly for data extraction. For example, last week I was doing data extraction and I was dealing with really extensive sheets, and I uploaded both of them to ChatGPT and Claude, and I found that ChatGPT cannot deal with extensive sheets, but Claude is really amazing and accurate, and the app doesn't give just general responses. It is really accurate and detailed, even when it comes to academic writing. So I guess that using Claude will help us work more efficiently.
Sounds good. Thank you for sharing this important area as well. So, yeah, when using the AI, as Dr. Alaa mentioned, you can try different ones with the same question, or you can get an answer and then modify it and give it to the next AI and see. Or, as Dr. Marwa mentioned, you can try the same prompt to both or more AIs, and then maybe you can also find which one is better for you. Thank you. Anyone else?
If that is it, I would like to invite our next presenter, Dr. Mohamed Makkawi, who will be giving us a presentation on apps that are used by interns, PGY1s. Dr. Mohamed, whenever you're ready, you can share your screen.
Yeah, hello everyone. Just let me share my screen. Okay. This presentation was already done by one of our colleagues here about a year ago, so I'll be just using the presentation again for it. It's going to be a brief one, and this I'm sure that most of you are already using most of these apps, but to give a reminder for those who may not have been using them, so that it will help them in their career. So I'll give brief introduction. What are the apps? And some specialties, they have their own apps, and maybe also in the hospital that you work in, they may have their own apps, so you can also check them out. So why do we use apps? Well, as you know, as technology improves, with technology improvement, we get more, the knowledge becomes more accessible. And long gone are the days that everybody has to memorize every single formula, have to calculate everything by themselves, and you have to have every information in your mind. Now, except those critical life-saving treatments, other knowledge can be searched easily with the tip of the fingers. So to make it easier, it's better to be in a format as an application rather than just randomly searching in Google. So as you know, because when you're starting as a PGY1, you start as a freshman, and can be a scary period since you just finished medical school and now you're starting to work, and now you've been treated as a new doctor, as a full-fledged doctor. So you may have some fears, you may have some, you may not be sure on how to act whenever you have a case to handle. So these mobile apps will help making decision making easier and gives you access to up-to-date knowledges and evidence, and can help you with managing clinical responsibilities. So apps, I'm sure that most of you have been using UpToDate and MD Calc. Then there is also UpToDate LexiDrug, which is really helpful for drug dosing. And then this is just one extra, it's an antimicrobial guide called Sanford Guide Antimicrobial. This will help you regarding in antibiotics on stewardship. It basically gives you a brief orientation on antibiotic stewardship and what antibiotics to be used. So UpToDate, It's an evidence-based clinical reference tool, and it will give you detailed information on disease, diagnosis, treatment, and guidelines. So it's not just useful for just treating patients. You can also use it as a very excellent tool when you're preparing presentation on a certain topic. So I personally, when I present a medical topic, I like to use UpToDate, since they give you all the information that you need and gives you the best management up-to-date guidelines in treating that condition. So most of you know that it's also it's a paid subscription, but fortunately most of the residency hospitals, they provide them as part of your package. So I'm sure that most of you as a resident will have free access to UpToDate. So highly recommend to use this app. Really great, excellent form of knowledge. Very quick. You can just search. You want a specific disease, you can find it. You want to find how to do a specific treat a specific condition. They show you the complete details, the recommendation level of each detail. So it's really great. And it's available in both App Store and Google Play. So you can see here, for example, if you want to look for adrenaline, they show you the types, like if you want adrenaline as a drug, formation, for pediatrics, for elderly. So it will help you in searching whatever medical condition that you are working on. It will help you a lot. Then we have MD Calc. I'm also been using it a lot. So this one will help you calculate any medical calculations and scoring tools. For some examples, if you are having, as you know, that calcium level can be affected if someone has hypoalbuminemia. So usually, so some labs, they correct it based on the albumin level, but many times they may not. So by using this tool, you'll be able to know that whether it's corrected or not. Similarly, all the scores such as CHAD-VAS score and Has blood score, they can be used to calculate it, and creatinine clearance. So the good thing is that also with MD-Calc, sometimes some countries use different units. For example, in the US, they use, for example, milligram per deciliter for glucose, while others use, for example, gram per liter. So they may use different units. So but fortunately, MD Calc has you can interchange those units. So it can be used in anywhere in the world. And also this app is free, so anybody can use it. You don't need a subscription for it. Available also on both Apple Store and Google Play. And it's important to follow the instructions that they give on how to calculate, and if there is any limitations or restriction on the tool that you're using. So just to keep that in mind. Then there is UpToDate LexiDrug. This one is mainly for dosing. So it gives you reference for dosing and drug-to-drug interactions. If there is any adjustment to drugs regarding renal or hepatic, if the patient has either liver failure or renal failure, so some medications may need adjustments. And if the drugs are compatible with each other, some drugs, when they interact, they either cause severe side effects or they may cancel their effects. So this UpToDate LexiDrug, it's part of the UpToDate family, but sometimes may require a different subscription for it. So just check with your hospital whether they provide it or not. Then finally, there is a Sanford Guide, my antimicrobial. This one will give you a selection of antibiotics and whether if there is any known resistant patterns of certain pathogens and pathogen-specific guidelines. So basically, a short antibiogram at the palm of your hand. So you can easily check if this antibiotic can work with this pathogen. But it's also important at the same time to see your hospital guideline. Sometimes they be very strict regarding what antibiotics can be used. So be sure to check with your hospital to see what antibiotics are used with what pathogens based on availability, cost, or known resistances. Then there is one extra app called Week EM. It was previously known as Week EM, now it's called EOLAS Medical. So it just gives you a brief, quick reference guide for if there is any case in emergencies. And this one also includes, as a part of its package, MD Calc. So it can help you it's just like an extra shortcut. Instead of downloading having two apps, you can have one. So EOLAS will also help you with emergency cases. You'll have all the algorithms such as the adult cardiac life algorithm or the pediatric ones. So it's really good, so that you can just quickly take a look at it and refresh your knowledge whenever you are, or even if you're in an acute case, it will help you to manage it. Then there are some other apps. I haven't been using them much, such as the ASOG app for OBGYN. Then there is PediStat for pediatrics. And then some apps that can be used for preparation of board exams, such as UWorld. I'm sure all of you have been using it. And ABFM exam prep for those who are going for family medicine, and Anki. And then there are others such as Epic, if you're using Epic in your hospital. So Epic is also available in Android or Apple Store. So you can also use it to check your patient's notes or add any notes or do any orders. And then some note-taking apps. Even the generic note app can be useful. You can just speak and it will record for you whatever you want to note down. It will be helpful if you want to record something quickly. And of course, YouTube, it's an app or a website, whatever you wish to use it. And as you know, YouTube has basically everything. So it will help you if you want to, even for surgeries, like if you're going to at least attend a surgery or look at a surgery, if you watch a video on how to do it, it will help you get the most benefit when you are attending a surgery. And if you want to look for further suggestions, of course, it's important to consult your colleagues in the hospital. They may know other apps that you may not have heard of, so they can help you with other apps. So they're also an excellent source. Some people also can use Reddit, but sometimes you have to be cautious. They may suggest something that may not be really useful, but that's why your colleagues will be your best bet in finding out other suggestions. And that's all. Thank you very much. If you have any questions, you can leave them in the chat box or ask now, and I will be happy to answer. Thank you very much.
Thank you, Dr. Mohamed. And if anyone with additional notes or experience that they want to share or use different apps, please go ahead.
Yes, actually. But first,
Go ahead, Dr.
thank you very much, Dr. Mohamed, for this informative presentation. It was really useful. It would give us an overview on many useful mobile apps that clinical doctors use on a daily basis. One very honorable mention, obviously MedCalc. I think no clinical doctor can go very long without. It has many of the essential calculators that we use on a daily basis, from creatinine clearance to the Chatfa score, just everything in general. And it's very useful because it speeds up all of your decision making, especially in critical conditions, and reduces your errors overall. So I think it's a very important app. Another one that I would like to mention that was not mentioned and is a very underrated app actually is First Line. I'm not sure if many have heard about it. I was first introduced to this app by a doctor I had met during my clinical rotation in Tanzania. just randomly I downloaded it, and I'm very happy I did, because it's very useful in providing antibiotic guidelines to all ages. I particularly use it for pediatrics because it helps me guide the exact treatment based on the infection type, and if there's any local resistance patterns and all of that. So yeah, I think it's very helpful. If you want to check it out, you can. It gives you very age-specific antibiotic choices with doses, and yeah, very helpful in critical situations for managing infections. Yeah.
Thank you once again, Dr. Mohamed. Thank you, Dr. Raghad, for adding this to the discussion. In addition, if not, I'll circle back to the topic we just mentioned or discussed. I'm going to share the screen here. So we were talking about the AI, which one you want to use. And when you use more than one, here's a new one that's called Arena AI. So it will give you a kind of battle or competition between two AI at the same time. So let's say, give me a list of mobile applications that can be used by a new resident in internal medicine, for example. So if you look, you have two assistants, basically assistant A and B, and then you can compare. So assistant A will pick up a random AI tool, let's say Gemini, and then assistant B will pick up a different one, let's say DeepSeek or something else, and then it will search, generate the list, and then come up with the answer. And then you can assess and see which one is good, and you can give your feedback. A is better than B, or vice versa, or both are equal, or you can rerun the prompt again so that you can get a better answer. Maybe they will use a different AI tool next time, if that makes sense. Not sure if it's gonna answer right away or.
Dr. Nader, will it tell me which AI model was used in each response? So whether that be A or B, like will it tell me, for example, A is Claude and B is ChatGPT?
I think so. Let me just double check. I used it a few days ago, so. So I'm going to share the screen again. So basically, I was asking about some coding, and it gave me two ones to fix my code. I have trouble. So this one, for example, A gave me how to handle it, and then B is a different one. So, okay. I'm not sure if it lists the model. Sorry, it's a long code. Oh man. Yeah, it will give you on the top which model did the AI use to compare. For example, this one used GPT 5.3. I'm not sure about Assistant B, but this is how it's gonna compare two answers or two models AI that you can use, if that makes sense.
Yes, it does make sense. Thank you very much for introducing this, Dr. Nader. Inshallah,
You're welcome.
will be put, inshallah.
Inshallah.
Yeah, and now can we move on to our next presentation, if that's okay?
Yes.
Dr. Nabiha will be presenting a very interesting and trending topic actually on hantavirus. Dr. Nabiha, if you can share your screen whenever you're ready.
Yes, I'm ready. Hello, everyone. This is Nabiha Naqvi. I hope everyone can hear me.
Yes.
Is there? Oh, okay, okay. All right. So I'm happy to give my presentation on hantaviruses today, a very trending topic, talk of the town these days. So let's begin. So what are hantaviruses? So these are the zoonotic viruses from the family of Hentaviridae and order Bunae-avirales. So there are more than 20 viral species, and the severity of the disease and the type of the disease vary with the type of the virus. In Americas, that is the South America and the North America, these viruses lead to the hantavirus cardiopulmonary syndrome, and these are caused by the genus orthohantavirus. While in Asia and Europe, they're known to cause hemorrhagic fever with renal syndrome, which affects the kidneys and the blood vessels, and are from the different type of hantaviral virus subtypes. So, what we have been talking about is hantavirus for a time now in 2026, and that was because there was an outbreak in the cruise ship carrying 147 passengers, and this happened in April, May. So the symptoms began from around 6th April to 28th April, and then on May 2nd, a cluster of passengers with severe respiratory illness were on cruise ship, and they were reported to WHO. And by 4th May, actually, 7 cases of hantaviruses were reported, among which 5 were suspected and 2 were laboratory confirmed. There were 3 deaths, and one was critically ill patient, and 3 had mild symptoms. So, in response to this outbreak, there was in-depth investigation about the reason of the virus. The cases were isolated and given care. There was medical evaluation done, lab investigations done, and then coordinated international response took place. So currently, WHO currently assesses the risk of the global population from this event as low, and will continue to monitor this epidemiological situation and would update the risk management. So now we need to see that what leads to the transmission of virus. So they're basically spread through in feces and saliva of the infected rodents, mostly buildings and areas infected with rodents, and they're commonly reported in rural settings such as forests, fields, and farms, because rodents are often very freely moving there. There's no prevention from the contact from the rodents leading to the transmission. Um, as for now, there's limited human to human transmission, but some transmission has been reported, especially in the variants in South America. So, what is the burden of disease of hantavirus in the world? So, it is rare, but it's a very rapidly progressive disease if it occurs, and can be deadly. About 10,000 to over 100,000 infections occur each year, and maximum cases are from Asia and Europe. The case fatality rate is less than 1 to 15% in Asia and Europe, and up to 50% in Americas. And this is how we calculate the case fatality rate. It is number of deaths by number of confirmed cases into 100. So, what are the signs and symptoms of hantavirus? So, the incubation period can vary from 1 to 8 weeks after the transmission. And then, as it's a virus, so we'll have the early prodrome symptoms that would be fever, headache, muscles, GI symptoms like abdominal pain, nausea, vomiting. And then, depending upon the strains, it can either progress to um, hantavirus pulmonary syndrome or hantavirus fever with renal syndrome. So HCPS is common in North and South America, and here the heart and lungs would be affected. So there would be sudden onset of respiratory distress, accumulation of fluid in the lungs, and shock. While if the patient develops hantavirus fever with renal syndrome, there would be low blood pressure, bleeding disorders, and kidney failure. And the important thing is to um, uh, go for the early medical evaluation and supportive care so that the patients are managed timely. How do we diagnose hantavirus? So, first and the foremost important thing is careful patient history because initially hantavirus seems like a lot of different diseases like COVID, ARDS, and we have to make careful different diagnosis and then the diagnosis. So it's important to know if there was any possibility for the rodent exposure, was there any travel history, and was there any occupational and environmental risk for developing the hantavirus. And then for the lab diagnosis, we have ELISA test to detect the disease-specific IgM or rising IgG antibodies. We have reverse transcriptase PCR to detect the viral DNA, viral RNA. And then we have a hantavirus antigen by immunohistochemistry. So by immunohistochemistry, we can also detect the hantavirus antigen. Now we come to the management of hantavirus. So, as we talked before, emergency department and ICU care for close monitoring and supportive management. Timely management is the most crucial and important thing in the management of hantavirus. Supportive care is generally with antipyretics and analgesics, as it's a viral infection. So, antibiotic is not generally recommended unless and unless there is a suspicion of bacterial infection. Careful fluid administration, hemodynamic monitoring, and respiratory support is very, very beneficial. Early ICU transfer for severe cases because it can lead to acute respiratory distress syndrome. It can also lead to renal failure and may require dialysis. So we need to have ICU care for severe cases. Ribavirin is an antiviral drug that has shown efficacy against hantavirus fever renal syndrome, but it has no effectiveness against the hantavirus cardiopulmonary syndrome. And there's no specific antiviral treatment approved for hantavirus cardiopulmonary syndrome. Now, how can we prevent and control the spread of hantavirus? Um, the most important, the first thing is to maintain the hygiene. So, frequent hand hygiene is the most important thing. Keeping homes and workplaces clean, sealing the openings that allow entry of rodents in the buildings, adopting wet cleaning methods, and avoiding the dry sweeping. Like only vacuuming is not the solution. We need to um, clean it with a wet cleaning method so that it is removed completely. We need to ensure that there is adequate ventilation in our homes, in our offices, and even in the ships and cruises in case someone is traveling. Safe food storage, avoid contacts with rodents, and currently there is no vaccination for hantavirus for the prevention. These are few techniques as to how we can clean a mouse urine and droppings. So the first thing is that we need to prevent ourselves from the direct contact. So we are going to wear gloves before cleaning, and then we are going to use a detergent or bleach and water solution. We're going to soak all the droppings or urine with the detergent for about 5 minutes, and then we're going to remove it and then safely discard it in the bin. After that, we are again going to clean the area with bleach and water solution, and then we are going to wash our hands with the gloves on at first, and then after removing the gloves, we are again going to wash our hands for our own safety. Similarly, if we find a dead mouse in a snap trap or nest, how do you remove or discard it? First is keep your own safety the priority. So we have to wear the gloves. Then again, with the bleach and water solution, we are going to soak the area for 5 minutes, and then we are going to put the dead mouse in the bag, and we are going to tie it, and then we are going to place it in the second bag. After that, we are going to discard it into the empty bin, and we are also, if possible, going to report it to the um health authorities so that they are also aware of a dead mouse. And then we're going to wash our hands with soap and water with gloves on, and after that, after removing the gloves. In case of outbreaks like the one we had in 2026, so early recognition of the suspected cases is the most important thing. Prompt isolation of the cases is very necessary to prevent the spread of the infection. And then we have to remain very vigilant of the hantavirus symptoms among the suspected cases, and also among the people who were in contact with the suspected cases. Active symptom monitoring for 45 days, close monitoring of the close contacts, and then adherence to recommended infection prevention and control measures to prevent the spread. In the healthcare settings, it is important that we follow the standard precautions for all the patients. We report the cases to the health authorities. All the suspected cases need to be reported. Hantavirus specimens are biohazard. We need to tackle them very safely, and strict adherence should be when following the protocols to how to handle those specimens. Ensure the safety of patients and healthcare workers. Transmission based precautions during the provision of care. So, any direct contact with the patient should be avoided. Surgical mask, if possible, should also be worn. And then, if there are any aerosol generating procedures being done, so airborne precautions should also be there, like N95 mask, gown, glove, eye protection. These are the reference, and thank you so much. That's the end.
Thank you so much, Dr. Nabiha. And it's an important topic, and it's current. So thank you so much for the update. Here's another update about the topic. The captain who was on that ship, he is fine, and there are 12 cases and no death since May 2nd. So this is a good news, and thanks for great presentation.
Thank you.
Yes, thank you
If
very
anyone
much.
has
Dr.
any
Nabiha.
questions, so yeah. Thank you so
So-
much.
You're welcome. Thank you. Any updates?
Hello, Dr. Nader.
Hello, Dr. Ala. Go ahead.
Okay, today I will present our project.
Yes.
Screen.
Thank you so much.
Yeah, welcome. Hello, everyone. Today, I'm sharing our project, Bridging the Gap, an audit of AI simplified dementia care resources, which was accepted for presentation at Alzheimer's Association conference. Let's start with the problem. Most caregiver resources for Alzheimer's or dementia-related condition are written at a postgraduate or academic paper level. These make it difficult to deal with this complex jargon, especially in a situation where the families are in overwhelming situation after they receiving the diagnosis. So to solve this, we use large language models in our study as linguistic filter to transform these complex documents to simple one, while maintaining the clinical accuracy. And the methods, we select 10 standardized post-diagnostic sheets from Alzheimer's Association and NHS. These sheets covering topics like safety, medication adherence, and legal planning. Each sheet was processed through Gemini, ChatGPT, and DeepSeek. By using the prompt, simplify these for a sixth grade reading level while maintaining clinical accuracy and empathetic tone. Then readability was measured for both the original text that we are entered to the AI and the AI generated one from this text. And we measured it by using Flesch-Kinkert grade level formula, and these applied by the website Gemini.ai app.com. Then a three independent clinician scored outputs on a 5-point Likert scale across clinical accuracy, readability, and compassion. Here an example or our 10 standardized post-diagnostic sheets we used. As you see, the first the title is just diagnosed. The grade is converted from 17 to 3. Also, you can see another example, number 7, managing anxiety and depression. There is a reduction from 17 to 3. Actually, all of them, they reduced from high grade level to low grade level. That can be simple and understandable by the families and caregivers. Again, there is a graph for our grades and the reduction. Now let's talk about our key findings. Our results showed that the large language models reduced the mean reading grade level from 15.9, which is a postgraduate level, to 4.2, which is a primary school level. So the readability improved by 74%. Also, the expert clinician gave the AI outputs a high average utility and fidelity score of 4.5 out of 5. But we found a gap in a compassion domain. And we can see that while AI models were excellent at making text simple, its tone sometimes felt cold with occasional clinical detachment. And that's the gap we found in compassion. Also, there is a potential for AI hallucination in high stacks and clinical context. These both findings of compassion gap and the hallucination risk proves that why we need human in the loop framework. I mean, AI requires human oversight to make this proper. Here an example of one of the sheets that we are used in our study. On the left side, it's before using AI to simplify it. The grade was 17. And on the right side, it's after using the AI, the grade became reduced to 3. As you see, the AI make them more simple, make them in points that can be understandable, applicable, and with a very good benefit for the caregiver and the patient. In conclusion, large language models effectively bridge the health literacy gap. And that's happened in our study. It reduced the grade from 15.9 to 4.2 across all the 10 sheets that we are used. There is 74% readability improvement by Flesch-Kingset analysis, and these shift toward patient-centered communication. The clinician expert scores confirm high utility, 4.5 out of 5, with minor compassion gap, requiring human editorial effort. AI should function as a clinical copilot with a human in the loop framework. They should not replace them. And the AI should integrate it into post-diagnostic workflows to enhance caregiver support and health equity. So I hope to see more researchers in the future talking about applying the AI in a different health condition and in a wide variety of language to improve the clinical outcomes. That's the end of my presentation. Thank you. I hope it was informative and you like it. If anyone have any question, feel free to ask.
Thank you so much, Dr. Alaa. This is excellent, wonderful presentation. Any comments or any questions? Anything unclear?
No, thank you very much, Doctora. I just would like to thank all the presenters for their insightful presentation today. And it brings us to the end of our session and all of our tasks done. A special thank you to Dr. Nadir for your time, your active participation, and valuable inputs. If anyone has any other contribution, any other thing to mention, space is yours.
Thank you all again. And I'd like just to share with you, this is an important course. If you are interested in family medicine or internal medicine, this might apply to you, the board review in internal medicine by Cleveland Clinic. So for you guys, it might be discounted at 100. I recommend that you attend, or it's virtual. You can register and you can have the videos available for you for 1 year, and you can put that in your resume as well when you apply to residency, for example, or another jobs outside. You will have the background up to date as far as treating patients and what's going on, and it's gonna be addition to your CV. So most likely they will ask you a letter to support that you are in this program. So I'll be happy to send you the letter if needed. I think the due date for this is in 2 days, May 25th. Any other ideas about the projects that you want to do, or any updates of the projects that you are working on, or topics that we want to discuss? If not, then I'd like to thank you so much, Dr. Raghad, and all the presenters from today. I'd like to thank all those who attended today's meeting and those who will watch the recording in the future. Thank you in advance. And if you have any questions, please let me know. You can contact me via email, text, or WhatsApp, or call me. I'll be happy to assist. Thank you, and have a wonderful day or wonderful night, wherever you are, and happy Eid. and we'll see you next week inshallah. Assalamu alaikum. في أمان الله.
وعليكم السلام. Thank you, Dr. Nader.
والسلام دكتور رغد.
Thank you so much, Dr. Nadir.
So much. Have a wonderful day. Dr. Marlene.
Yes, sir.